everyone. My name is Aistė Ramanauskaitė, and it is my absolute pleasure to extend a warm welcome to all of you today that are joining this exceptional webinar. UCARE for You returns today with a robust and profound topic that holds a very special place in my heart: patient empowerment, education, rights, and representation, which all falls under the wonderful umbrella of patient organizations. Every part of our healthcare sector is meticulously designed with a singular goal in mind: to achieve the best possible outcomes for our primary focus, the patient. We are all well aware that sometimes guiding the patient towards the highest possible quality of life is not always the easiest path. Yet, as a physicians, we are fortunate enough to be not alone on this path. We have a remarkable pillar of patient care that is sometimes a little bit overshadowed. Therefore, we are bringing the spotlight today right on our main focus, the patient organizations. And those organizations serve as a unifying force, bringing all various strands of healthcare decision-making to one table. They are frequently the catalyst of positive change and the driving force behind the development of improved healthcare systems, while also serving as an empowering influence for our patients. And today, I'm fortunate enough to have my great colleagues together with me on this webinar that are better than anyone familiar with what patient organizations are, what does it mean to be a part, to build one, or to be actually involved in patient organizations. So on this splendid international setting, we focus squarely on patient organizations. And I am pleased to introduce you my colleague, Kristen Willard, who is an educational consultant at Global Allergy and Airways Patient Platform, as well as Arzu Ahmed, our colleague from the UK, who is head of ethics at Our Future Health. We will delve together with my colleagues into what do patient organizations actually do, what they represent, how do they operate. And this will be covered by our lovely colleague, Kristen. Then together with Arzu, we'll take a closer look at the advocacy and how does that work, what benefits do the patient get from it, as well as together with me, we'll overlook the mutual benefits that physicians and patient organizations gain from their collaborative efforts. These webinars are designed with you, our lovely patients, beloved colleagues in mind, to help you discover the answers, engage in the subject material, and experience the sense of empowerment, as well as get a wave of motivation after this webinar. Therefore, I highly encourage you to put all of your notes, questions, impressions, everything you might think of in the Q&A window down below. And our panelists are eagerly looking forward to engaging in the dialogue with you. I will be assuring that we will address and acknowledge everything you're interested in, and all of your questions would be answered. So without any further delay, I'm delighted to introduce our panelists, Kristen, who is better than anyone familiar with what are actually the patient organizations, how do they work, how do they function. So Kristen, the floor is yours, and I'm very happy to have you here today on board.
Thank you, Aistė. That is one of the nicest introductions ever. I really appreciate that, and all the beautiful things you said about patient organizations being a unifying force and the catalyst for change. I'll take that forward as I move into the presentation. And I would love it if you could pull up my slides now, and I'll just give a brief introduction to who I am while you're doing that. So as she said, my name is Kristen Willard. I lead education for the Global Allergy and Airways Patient Platform, and we finally call that GAP. I live in Washington, D.C. I want to thank everyone for being here today, and of course, Galen, for the invitation to speak. This is a particularly meaningful time for me to be with you, because I have been a person who has suffered from hives off and on my whole life. So it's really a special honor to be speaking with you. So if you can go to the next slide, I'm looking forward to telling you more today about the what. We're going to start with the what, the how, and the whys of patient organizations. So let's start with the what. I have had the honor in my career of working at two different patient organizations, and with partner organizations too. And this list here are some of the aims that collectively we all hope to meet in our work. The first one is extremely important, elevating the patient voice. So Patients are at the center of all that we do. This is particularly important for people with conditions that are more rarely addressed, let's say, in society. We know that people with certain conditions are really not asked to talk about their experiences, about their needs, about their goals. And we are there to elevate the patient voice. We are there to ensure that patients are heard, because that is essential to success and to change. We do our best, I'd say, to take the voices forward, even when patients and families cannot be in attendance. We empower patients. We work hard to do this, to support them in engaging in their conditions and with those around them. We know that that empowerment has been shown in research to improve patient participation in care. So that's another element that's particularly important to us. We are devoted to education, and this is what I do every day. We can educate, of course, patients, family members, as well as the healthcare professionals who support them every day. The next bullet, take a look at this one. We work to create a community and connectedness. This is so very important to the success of people who are experiencing a condition like all of us. Peer support is one way to do that. We know that that's often a component of patient organizations, and there's good reason for that because it's so successful. We also know that it's important to create that community and to work for that connectedness because it is associated with improved well-being, and that's essential to patient success as well. The next one is establishing trust and credibility. I think we as patient organizations do that among patients and families, but also in general, for the illnesses or the conditions that we represent, bringing credibility to those and elevating them into the conversation when they may not have been there before. And lastly, I know this is a big focus of what we're talking about today, but we try to equip both individuals who have conditions as well as their providers to improve the communication, improve the relationship between the two. We do that by equipping them with tools to improve shared decision-making, disease understanding, self-management, and more. So let's go to the next slide. So you might be thinking to yourself, how do we do all these things? Well, there are several pillars here. These are essential to our work at GAP, but I think that you'll find working with almost any patient organization that these 4 pillars are the foundation of the work that's being done: awareness, advocacy, education, and research. Next slide, please. So first, we're going to talk about awareness, and this brings us into, again, the how are we doing all these things? In part, this is alerting patients, family members, as I said, healthcare professionals, but it goes beyond those groups, those audiences, to policymakers, to industry, to other stakeholders, but it's alerting them to many issues that all of these communities then face. So think about a basic awareness campaign. What is the condition, right? How many people does it impact? What steps can we take to better manage and better treat this condition and support people who have this disease? What resources are available, etc. It's bringing that awareness to the forefront and elevating, like we said, the patient experience and the patient voice. We can do this in a variety of ways as a patient organization. These are just examples that you see on the right-hand side. Educational materials, which of course are my first love. Communications campaigns, we have all seen those on televisions, on bus stop signage. We have seen those in our emails, etc. Advisory boards are another way to do that, where we ensure that the patient voice is front and center, caregivers as well, front and center, to tell industry and others about what's important to them. And research projects are an excellent way to be involved, to increase the awareness of the people who are involved in the project themselves. So 2 examples of how my organization, GAP, is involved in the chronic urticaria space in awareness would be Urticaria Voices Awareness Day, as well as World View Day Awareness, and I'm sure you're familiar with those. So just think of those as sort of an umbrella campaign that gets awareness far and wide as much as possible about chronic urticaria. So that's one thing. That's our first pillar. So awareness, let's keep that in mind. And now we'll move to the next slide, which is advocacy. Thank you so much. I think of advocacy as having two arms to it. The first of the arms on the left-hand side is self-advocacy. So let's talk about that part first. I think of self-advocacy as stepping outside that traditional relationship that we used to have with providers, the sort of paternal approach to medicine, where we didn't ask questions, that we were not involved in our care. And I think organizations now, like mine, can help to encourage people to be a partner in care, right? To be involved in shared decision making. So what might that look like? For example, we might encourage that for an individual who has chronic hives and medication was working for some time and you're noticing it's no longer working, not waiting until your next visit, following up when you notice that your symptoms are getting worse, calling the office, putting a message in through the portal, however it is that you get in touch with a provider rather than waiting until your next visit, which is how things would have gone 20 years ago, right? So it's helping to instill an understanding that advocating for yourself can result in better health outcomes, right? Next, on the right side, I think of the second arm of advocacy. That is the one that you think of, which involves lawmakers and public policy. So it's really helping to insist that our governments, healthcare professionals, the public, and any other stakeholders really do the right thing for our patients. I think that's exceptionally important. There are many, many different issues that groups bring forward, different by condition, let's say, but many are similar. So things like early diagnosis, access to care, access to medications, etc. So I think of that as sort of the second arm of advocacy that we're all involved in together. Two examples before I move on of GAP working in this space would be the chronic urticaria patient charter being one of those, as well as a CU shared decision aid, which is exactly what I talked about before, about getting together to discuss symptoms that have been documented, to talk about goals, etc. So there are two ways that we help to support that. Let's move to the next slide, which is one of my favorites. It's education. So in education, we can teach individuals who are impacted by a condition about their condition, right? When we're diagnosed, we often don't know anything about what it is that we are dealing with. We can teach them about the self-management I talked about symptom tracking, about education on nutrition, activity, taking medication as prescribed. The list is long and wonderful. We also teach providers about the basics of conditions, about treatment pathways, about best practices to improve care that they may not be aware of. So I think that our organizations can play a very strong role in education, doing that by creating, by events like this one. It's a really good example of that, through interactive videos, through quizzes, through apps. We do it through continuing medical education. We do it through supporting the guidelines that our providers use in treating and managing conditions. So it really runs the gamut. It's almost limitless what we can do under this pillar. And we know that it's important to do that. So the question might come up, why is education important? It may seem intuitive, but I think it's important to point out exactly why it's such a focus for so many of our organizations. We know, you can see there on the bottom right, that education improves self-efficacy. We know it improves quality of life, adherence to medication, which is incredibly important for any patient population. So many, many benefits to providing, thorough, I will say, evidence-based patient education, and for others as well in our communities. So I'll give you the two examples that we at GAP would work on with respect to chronic urticaria. We're proud of the podcast with the Galen UCARE network as one of these, as well as the chronic urticaria coffee chats and the GAP Academy, which in the coming year, those are our capacity building webinars for our member organizations. We'll work on topics specific to chronic urticaria organizations. So that's nice to be able to bring that to the forefront. Let's go on to slide 6. Last but not least, as they say, is research. So this is the last of the pillars. Patient organizations are involved in research that should be important to patients. This can cover many topics. So I've just listed a few: preventing disease, developing better treatments, improving care and the patient experience. I think just as with education, there are nearly limitless research questions to be asked. There's much that can be done here. But I think the big takeaway is that any patient organization is looking at research or looking to research questions that are important to patients and their families, and that's where our focus should be. On the right-hand side, patient organizations and the people that we serve are involved in research in many ways. So you can see their clinical trials, survey research, focus groups. We, as a community, also provide the patient voice to industry. And when I say industry, I'm speaking to pharmaceutical companies. It could be device companies as well as researchers at universities and in academia, medical centers as well. Another thing we do at patient organizations is we are sure to share the results widely. There is no sense in doing research that sits on a shelf. So it's important that we put out lay summaries that our sort of non-healthcare provider or research-oriented communities can understand, as well as share these results in journals and conference presentations too. And we use these data, as you can see on the bottom right, to affect change, to make change. We want to improve care. We want to make convincing arguments to our legislators, to our policymakers. We want to move new treatments forward. And that's where we get the data to do that. So my last example of the work that we're doing at GAP and how that relates to this pillar in particular, in Berlin at the EADB conference, recently we presented 3 abstracts on chronic urticaria. Again, important not to keep that information to ourselves, but to get it out for people to use and to build on as well. And next slide, please. I appreciate it. So the last question was why? Why do we do what it is that we do? And this, I think, is very simple. We can achieve the awareness, the advocacy, the education, the research objectives that we want to together, right? All of the stakeholders in this conversation that you can think of that I've mentioned many times now, with our patients front and center, and that's really what we want to do. Our organizations, as you said, I love this, I wrote it down, are unifying force for that. We help to lead, we help to organize the communities to that end so that we can speak with one voice, really. So I hope this helps a little bit in understanding what it is that we do in sort of a nutshell. The last slide that I have just contains my contact information on the next slide, if you have any questions to follow up with me about.
Thank you very, very much. It's a lovely talk. And I was sitting the whole time and wondering how great is actually to have something like GAP available in your community, whereas sometimes it's not that easy. And we know that in different parts of the world, which UCARE is actually a very international setting with different backgrounds, what would be your main advice? What would be the first steps to the patient that is looking for initial help, looking for joining a new community where maybe there is none? How do you actually receive the help that you need? And what should you do as the initial steps to achieve that?
Yes, I think, and then that's a question I think we could all answer. I think my first reaction is to go to the internet and go to trusted sources. Ask your physician if they know of any organizations. But I think it's nice to be able to go online and find professional societies that can then lead you to patient organizations. It's really a matter, though, of just making sure you're finding something you trust, right? And then once you get there, I think you can find the community, whether or not it's in your precise location or not. Could be an online forum, right, that you have that you're able to engage with people across the country. You may be able to find, local support groups, etc. But I think it's starting there and asking, I call them your wise people that are in your group. anybody else who has the same condition, asking your physician or any healthcare providers that you see, as well as using the wonders of the internet for good to find organizations that might be of assistance.
Yeah. And if I may ask, what was your personal driver leading you to joining patient organizations, and what's keep you going? What is keeping you going further on? And what have you taken out from it so far? Because you have been working on patient organizations for a while now. So what is something that is worth striving for?
Oh, that's such a beautiful question. So I worked previously at the COPD Foundation. I came to that organization because I lost my father over 10 years ago to COPD. So it gave my work a meaning. I had a driver every single day because I wanted to change the experience for people just like my dad and the families just like my own. And now I'm lucky enough to work at an organization where we're focused on conditions like chronic urticaria, which I experienced myself. So that is a real driving factor. I think what keeps me here is there's nothing like working at a mission-based organization with some of the most passionate people you will ever meet in your life, and actually knowing that it is within reach for you to affect change for patients and their families. I think that's a beautiful thing to wake up to every day and to be able to do.
It's amazing. I'm happy to hear that. And thank you for moving forward, for pushing GAP forward. And I just want to thank you once again for your contribution.